When you're talking to your clients about diet history and history related to gastrointestinal disease, the key that I found is to make sure that you answer make sure that you ask questions that don't have a yes or no response. So a classical type of question could be, tell me about how you feed your pet through the day. So it gives the owner an opportunity to really share everything that they do in terms of feeding their animal, and think about the response that you would get from that type of question compared to what type of food do you feed your dog. So in the first question, they may actually share pieces about the day that include treats, their food, any sort of snacks that they have in the middle of the day. And you can start to ask them more about, tell me about more people in the house who might feed your animal, and start to get the information through asking an open-ended question versus a straight yes or no, or I feed my dog Royal Canin. And we can gather a lot more information when we do it that way. And it also helps the owner to feel like there's no wrong answer. When you're approaching a diet history with a new patient or a chronic patient, I think you do start to change a little bit of your questioning or the types of questions that you're really interested in. But I would encourage, even for those patients that you've had long term, make sure that you ask the questions like, describe to me again how the diet's going or how you feed your animal through the day, because it is very common in my experience that things change from what you recommend to what actually happens when they go home. And I've had this happen with patients in the past where I've done home-cooked diets that are very specific. They come back in and they don't share it right away, but then they tell you, oh, well, yeah, we were feeding some treats during training, so the dog got some extra chicken nuggets, or these things come up usually when you go back and talk to the owner if you haven't really given them the opportunity to share that in the initial consultation. So it's really important to remember that even if they're a long-term patient, they've been on a prescribed regimen, to still go back and give them the opportunity every time they come in to share how things are going. And ask it in a way that you would even expect that they've done something different. Because if they feel like they have to stay right on plan or else they're going to get in trouble, they probably won't share all those things. So you can ask, tell me about any other food you may be feeding or the dog may have gotten into. Give them the opportunity to share those things in a way that they feel comfortable and they're not going to get in trouble for sharing the additional information. When dealing with GI cases and getting a diet history, a very long-term and thorough history is important because we want to look for patterns of how the animal has reacted to different types of foods. We also want to see how the animal responds after eating, if those clinical signs occur directly after eating, if they occur hours after eating, or maybe they occur, with an extended period of time when they haven't been offered food. So asking about both what they're eating and the feeding practices, how many times a day, and when the clinical signs occur relative to eating, those are all very helpful. When you're talking about a chronic case of gastrointestinal disease, one of our top priorities is to see if the animal will be responsive to an elimination diet or a hydrolyzed diet. So getting a good history, understanding the different foods that they've been on is very helpful for selecting the right diet. And also when I'm looking at a GI case, I'm also interested in not just the protein sources, but the fat content that may be associated with the clinical signs, or dietary fiber that may be associated with improvement of signs or worsening of signs. So you will get into some of these additional details for our gastrointestinal cases. So for GI cases specifically, I ask the questions very similar to other cases. The main difference is focusing on the clinical signs related to the gastrointestinal disease in association with when they were fed or eating. So that might be a little bit different. And when you're questioning about the clinical signs, you can also add some additional questions just around the characterization of any vomiting or diarrhea and start to get into some of those additional details in helping to discriminate between small intestinal or large intestinal diarrhea, things like active vomiting versus regurgitation. So early in the process, I do discuss dietary history in terms of any foods that have been fed that are human foods or treats. And this is important for any patient, but particularly GI patients. If we focus only on asking questions around what type of pet food they're feeding, we'll miss a potential huge portion of their nutritional intake. So asking about history behind treats, human foods is always important, particularly in our GI patients. I had mentioned that I would be interested in knowing about the fat content, so we could find that perhaps the animal is on a relatively low to moderate dry dog food, and we may come to the conclusion that they are on a low-fat diet, but if we ask questions about what they're feeding from human foods or treats, we often find that that can be a source of a lot of dietary fat. If they're feeding something like peanut butter or hot dogs, that's going to provide a lot of dietary fat. So if we see that those clinical signs come up when they get those kinds of foods, that can give us some insight on how we can improve our diet recommendation. For your gastrointestinal patients, a lot of the history with the animal in distinguishing between regurgitation and vomiting or large bowel and small bowel diarrhea can be very important. It's really the clinical history that really helps us differentiate these two types of syndromes. So starting with vomiting and regurgitation, you can ask questions again about when does the symptom occur? Is it shortly after eating? And often we'll find with regurgitation that will happen more soon relative to the time that they ate. The classic way to differentiate between vomiting and regurgitation is this active versus a passive movement. So you can ask questions around, does it seem like the food just passively comes out? Or do you see this abdominal contraction, maybe some salivating, and then this more active vomiting occurrence versus a more passive regurgitation occurrence? So asking some questions like that can really help you differentiate between regurgitation and vomiting. Sometimes these questions, the owner may actually not know right when they come in, but they can go home and observe these things. So with today's day of smartphones and cameras, you can also ask the owner to take a video. And when you've asked these questions, then they start to know what to look for. So it may be that on the first consultation, it's hard for them to really give you the details to distinguish between regurgitation and vomiting. But if they can go home and look for those signs, and if they can go home and take a video, even better. So same with differentiating large intestine from small intestinal diarrhea. We can ask questions related to the behavior of the animal. With a colitis or large intestinal diarrhea, we often see that there's this urgency for the animal to go, that they'll go frequently, multiple times through the day. And often when they go, they don't have a large volume of diarrhea. There can be this even appearance of straining, fresh blood, fresh, frank red blood in the stool, or mucus. Those are all the classical questions to ask to point us towards a colitis. And then on the other hand, with the small intestinal diarrhea, we may not see that the frequency increases, but we often see that the volume of stool increases, The consistency, again, is a diarrhea, but we may be more likely to see some dark stool, some melena, so indication of blood in the stool that has gone through digestion versus the frank blood that we'll see in the large intestine. And in addition to just the clinical signs of around the diarrhea episode itself, you can also look towards the patient and look at other things like weight loss. We often see more weight loss and signs associated around small intestinal disease versus large intestinal disease. And again, just like with the vomiting versus regurgitation, these may be things that the owner hadn't paid particular attention to, but could go home and take a picture or go home and make some observations after you've asked them some of this questioning at home. So the investigation doesn't necessarily stop at that first visit. You can equip the owner with the right things to look for, and they can go home and gather some more information for you. For an acute case, and these cases that we see where the pet has gotten into the garbage, the details that I'm usually looking for are around, what things did you eat that day that may have made it into the garbage? A common history is it's chicken or something meaty, fatty scraps. So we often see a history related to something very high in fat that they got exposed to. So that is a very common history with association with pancreatitis. So some of those cases, you may see a history related to that. I mentioned chicken. So a lot of these cases, we might worry about intestinal obstruction if it's an acute case. So you want to ask questions around things that they could have consumed that may be causing a physical obstruction, and taking a radiograph will ultimately be the way that you can diagnose that. But asking some of these questions can increase your suspicion on if it's going to be a more severe case that you need to get a radiograph right away and be more concerned about obstruction, or give you some clues about what kind of high fat foods they may have consumed. And then of course, toxins or things that they could have gotten into that could have made them sick in that way. It's always good to ask the owners if they know of anything that they fed, anything that may have been around the house. So these are all important details to get into, and some of the questioning that may point you towards more of a toxin, that could be related to other clinical findings that you see on the exam. But often in these emergency cases, owners may not know the details of what they've thrown away or what they've had, but any information you can get around the details of what they might have gotten into will just help you get to the right diagnostic and solution quicker. With chronic cases, a very thorough diet history, again, is always important. When I have a chronic case, it's also helpful to get some history around any sort of fluctuation in their clinical signs. So sometimes we'll see that an animal has a very long history of having GI problems, but it may come in waves where they could be having a lot of clinical signs for a month or more, and then have a period where they're doing better, and then it flares up again. So you can ask some questions going even further back into the history than you might normally. We don't know all of the reasons why some cases of chronic diarrhea or chronic vomiting go back as far as when they were a puppy, but we've seen some things that make us think about puppies that may have had parvo when they were younger, puppies that have had long histories of giardia, or these things we see that they might have more problems later in life. So just questioning all the way back to when they're a puppy and how things have cycled or changed can just give you some more information about the case and what you may expect as you introduce nutrition and therapy, and some things to look out for if you've seen trends in the past. Good diet history is a must for every GI case, even on those rechecks. I recognize that it can take a fair amount of time. So not only is the veterinarian feeling the pressure during the short time that you may have with the client may feel the pressure of the short time they have with the doctor during the appointment. So a good practice is to have a diet history form that the owner can fill out before they even come to the visit. So if you can send it to the owner in advance, they can be prepared with writing down the names of the food that they have at home, the types of treats that they have, because they may not be able to recall that information when they get into the office. They may know that it's a Royal Canin diet or a certain brand, but they may not know what variety. They may not be the person who actually goes to the store and buys the food. So sending this type of diet history form in advance is always helpful. It allows the owner to really be more thorough, and it can save time during the visit. And it's a nice documented form too that you can look back later and have that in the record. And I think you'll find that it's a pretty easy practice that the owner will appreciate and you can appreciate, and it helps save time and be more efficient. Diet history forms for GI cases and other types of cases are usually very common. We want to ask the same type of questions independent of the disease. So I wouldn't say that you need a particular GI specific diet history form to have the owner fill out or have the owner question. When you do have those GI cases, you may want to start to ask some questions that are more specific around the clinical signs and how that relates to what they've eaten or the occurrence of the clinical signs relative to the timing of the meal. But for your basic questions for a nutritional diet history, the key is to be open and thorough for any case. So I would just encourage something that is easy for the veterinarian, for you, the veterinarian, and for the owner that they can be consistent with. So just making it a routine type of question that have the owner tell you about what they feed over the day. And that's going to be the best way to get the information for any case, including a GI case. The key pieces of information for a veterinarian to get about their GI patients is really just what foods the animal has eaten in relation to their clinical signs. So sometimes we will just assume that they were on their normal diet when they had the clinical signs, but asking particular questions around, okay, we had an episode of diarrhea. Tell me about what the animal ate that day and how that might have differed from normal. And I think just investigating again in what they've eaten in relation to their clinical signs today, and also what they had in the past, types of foods they've been on, and how their clinical signs have varied over the years. So very similar to any case, but particularly for a GI case, getting that information about the diet and how it relates to the clinical signs are going to be the key factors. So the information that I get from a diet history is going to be important for the differentials and diagnostics. When we see patterns around episodes related to high fat intake, if we're looking at a dog, that may increase our suspicion of pancreatitis. So we'll want to do a PLI test to check for that. It may lead us to do some different types of imaging if we have a history about consuming food from the trash, or if we're considering pancreatitis, getting imaging of the pancreas. So these history pieces can give us clues on the most important diagnostics to do next. And then again, when we pick a diet for an animal with gastrointestinal disease, the one thing that I found is GI disease tends to be very individualized. And you'll notice that we have a lot of conditions that are diet responsive, and it may be fat responsive or fiber responsive or highly digestible diet responsive, or even something more hydrolyzed or novel. And we tend to make the diagnosis based on how they respond to the diet. So in some ways, you feel like you don't really have the diagnosis until you try the food. So some of the diet history can really give you some clues on what you should try next, what they may have fed in the past, how they've responded to that. So if you've already seen that they've tried low-fat foods in the past without an improvement. It may give you the opportunity to try something different, like a higher fiber diet. So getting the diet history, what has worked, what hasn't, can really help you in your nutritional recommendation moving forward. When talking to clients, using tools like fecal score charts can be very helpful. I think one of the great stories I heard from a gastrointestinist, internal medicine specialist, was that he went to a cat show and he got a fecal sample from an owner, and they put it in a nice bag for him. He was going to take it back and include it in his clinical study, and he held it up and it was almost like cow pie. He described it as soft ice cream. And he asked the owner if this was normal. And the owner said, "Oh, yeah, that's normal for my cat," and didn't have any concerns about it. So I think sometimes we assume that the owner's perception of normal is the same as our perception of normal. So it's really important to have tools like a fecal scoring chart where you can show them, here is a scale, here is the fecal score of a 2 or a 3, where we would like to see your patient if you're looking at a scale on a 5-point scale, and kind of ask them to look at that and see what they see normally in their patient. The one thing that I would also point out too is when you have a cat, they're going into a litter box, and sometimes that can make it hard for the owner to really visualize the stool because the litter will absorb some of that moisture. So you can talk to the owner about that as well and what that looks like. Maybe the clumps are looking more like urine clumps because it's a liquid stool, and that could be hard to differentiate. So again, using fecal stool score charts and taking advantage of smartphones and taking pictures can be great opportunities to really better understand what the patient's diarrhea or stool looks like and how that may or may not line up with the owner's perception of normal. Yeah, when questioning the owner, some good things to keep in mind or some tips are, don't expect that they would know what blood in the stool would look like, for example. So we talked a little bit about differentiating large bowel from small bowel diarrhea. So you may say, "Do you ever see blood in the stool?" And they'll say no. But then they later might describe or show you a picture of something that looks dark and tarry like melena. And you might think, well, I asked them if they saw blood and they said no. So be clear in describing what that blood might look like. Even if it's frank red blood, they may just see a small streak. So maybe when you ask if you see blood in the stool, their mind goes to something much more obvious, like a laceration and lots of blood. But you can be a little bit more detailed and ask about some small subtle things that they might not have recognized or thought to tell you. And I think it's very common when you're talking to an owner, not that you want to lead them into an answer, but if you ask them more specifically, have you seen anything that looks like mucus? Have you seen anything unusual? They may say, oh, now that you mention it, I did see this particular sign, and I didn't think to tell you about it because I thought that was normal. So getting into some of these details, and again, sometimes the owner may not recognize it on the very first appointment because it's the first time that they've been questioned or asked about some of these details. But you can even ask them, well, when over this next week before I see you at the next recheck, keep your eye out for some of these things, and even snap a picture if you see anything unusual. Yeah, for the physical exam side for a gastrointestinal patient, you're going to definitely want to do a rectal exam. It's something that you'll probably do on most of your physical exams, but make sure that you get a rectal exam in for these patients as well. When you do the abdominal palpation, some of the things you can pay attention to are any signs of pain, tightening, or tension of the animal as you're doing your abdominal palpation. And then if they are relaxed, you may be able to get a feel for the thickness of the small intestinal loops or a mass, anything that might give you some more information. And looking at the oral cavity, that's the start of the gastrointestinal tract. So getting a good oral exam and just making sure that there's nothing that may be contributing at the oral cavity that may be contributing to the amount of food that they're eating. But an overall thorough physical exam is going to be helpful for any patient, including your gastrointestinal patients. So the key aspects of the history that'll guide the diagnostic tests are some of the things around if you would want to do some additional testing to look at perhaps a CPL or a TLI. These are some of the pancreatic enzymes or immunoreactive tests that can help you rule out exocrine pancreatic insufficiency or pancreatitis. So if you have a case that is reporting large voluminous stools and a lot of weight loss with a high appetite, that's going to be something that's going to be a red flag for EPI, for example. So you'll definitely want to include a TLI in those cases and also check cobalamin and folate. If you have some signs related to the pancreas and it might be pancreatitis, again, including a PLI. And then also imaging is going to be driven a lot by the history. And then for all of these cases, we want to do the routine diagnostic of a serum chemistry, a CBC, because a lot of gastrointestinal signs could be related to other metabolic causes. So ruling those out is always important. And then, of course, ruling out infectious causes. So for any GI case, we always want to do a fecal test looking for any pathogenic causes of the diarrhea or vomiting. So the key aspects of the nutritional history that guide the next steps will be really acute versus chronic problems. These will be one of the key things in differentiating how you approach the case. For chronic cases, my next step would be doing some sort of elimination diet challenge, trying to see how they respond to a hydrolyzed diet, perhaps. For acute cases, you'll be thinking a lot more about some of your acute causes, dietary indiscretion or getting into the trash that we talked about, or acute pancreatitis, trying the animal on a highly digestible diet and monitoring them closely in the next few days to make sure signs don't become rapidly worse. So that will change a little bit of your management and diet recommendation. But moving forward, we're going to look at, keep a close eye on all of these cases and think about having them give us the feedback on how they respond to your nutritional recommendation in the next couple of days. And then for chronic cases, we'll want to do a recheck in about 2 weeks and see how they're responding to the diet. If you find yourself in a case where the owner isn't really able to provide you with very much information regarding the diet or the history, I wouldn't become too discouraged or frustrated because that's common. So, having the owner go home and keep an eye out for some of the clinical signs that you're asking them details about, but also going home and writing down some of the diet history can be helpful. I think just having the open conversation with the owner saying, based on the history that we know today, we aren't as confident in knowing how diet would be related. So what would be helpful for us is in the next day or two to go home and keep an eye on some of these things, maybe check on the food that you were eating, talk to your family, see what foods they may have fed, and provide some of that follow-up on a recheck, either a phone call or a recheck appointment that they schedule. And then to help prevent this frustration, having that diet history form or some questions that you can provide to the owner in advance of the appointment so that they can come in prepared is always a great help to prevent the frustration in the first place and give the owner a chance to give it a little bit of thought and write down some of the information that will be helpful. So for closing thoughts on your gastrointestinal cases and asking diet history questions, I would just encourage you again to make sure to be very open-ended in your questioning. Make sure you give the owner the opportunity to share a full history or a full picture of what happens over the day, not just the specific type of food that they're feeding, and take advantage of some of the tools like fecal scoring charts, smartphones, diet history forms to get as much information as you can, and also see it as a opportunity to test and try a diet and see how they respond, and a little bit of trial and error. I think sometimes, like I had mentioned in the past with GI disease, it's a very individual, patient responsive type of condition. So giving the owner a little bit of insight to that too can be helpful to help with their expectations. You can let them know we're going to try this diet and see how they respond. If the dog doesn't respond, we'll try the second diet, or here's what we'll do after, to give them the heads up that this is part of the process. We're going to try a diet. We're going to see how they respond. That's going to give us more information. And then when the owner is prepared for that and that journey and they can see it, it helps, if the dog unfortunately doesn't respond, that they're not too discouraged and they know this was a possibility. So it's a journey with the owner and a journey with the pet, very individualized when it comes to GI disease.